Hello and welcome to another Facebook and YouTube Live for Keith RN. You are in the right place, even though I am not Keith. I am Maria Flores Harris. I am the nurse consultant for Keith RN. If you're checking us out for the first time, this live stream is to support you, the educators, to support your needs and empower you with the practical strategies that you need to develop clinical judgment in your students so they are better prepared for practice and for licensure. To tell you a little bit about the Keith RN company before we get started, Keith RN was founded by Keith Brisher about 12 years ago with the vision to lead changes needed to reform nursing education and to close the ongoing gap on how nursing is taught and how nursing is practiced. Our resources focus on the development of clinical judgment to improve practice readiness and patient outcomes. So our mission really is to transform nursing education one educator at a time and to better prepare students for practice. With that said, I cannot go any further without saying Happy Nurses Week. Thank you all for joining. This is a week where I hope you've been celebrating yourselves. Keith and I are blessed to be a part of the nursing community, and we're honored to provide a platform to showcase the abundant talent that we have in nursing and nursing education, like the guest that you're going to hear from tonight. So I want to thank all of you, and Keith also wants to thank all of you. He is in the background for your contributions to develop, strengthen, and inspire our next generation of nurses. With that said, I want to know a little bit about you. I'm going to continue to talk a little bit. And while I do that, before we bring on our guest, if you will, I'm going to bring up my chat here just so that I can see it. If you will, please put in the chat who's joining us. If you don't mind sharing your name and where you're from, I would love to see where you're joining us from tonight. So tonight our topic is on professional identity formation. More specifically, we're going to talk about how educators can ignite, inspire, and illuminate professional identity formation in our future nurse leaders. So we are going to be talking to you, the nurse educator. Let me check out chat here. We have Anita from Lynchburg. I just talked to somebody about Lynchburg. It's actually someone that works for Keith RN is headed to Lynchburg, headed to your area, Anita, this weekend. And Sonia, hi, Sonia. I talked to you a few weeks ago. And Tina from Pennsylvania, Jasmine from Atlanta. Atlanta, we're not too far away, Jasmine. I'm in South Carolina. Another one from Pennsylvania, North Carolina. Welcome, guys. It's so good to see you guys. Thank you for doing that. We'll continue on here. I do want you guys to know that we do have all of our prior Facebook Live events, and we've had some great ones this year so far. We've had some great ones in the past as well. But we have all of those on our YouTube channel. You can subscribe to our YouTube channel, Think Like a Nurse YouTube channel. And you can go to live events to see our past live streams. And what I'm going to do here is I am going to put a link for you in the chat. I'm copying and pasting to the YouTube channel. And that way you can go directly to that link in the chat if you would like. And sign up for our YouTube channel. The YouTube channel is there for you. We provide lots of great information for you as the educator to help you with building clinical judgment and to helping prepare your students for practice. There's also another group that I have to tell you about, and I call this our support group. It is not a Keith RN salesy group. It is what I call a support group for nurse educators. It is our Facebook group, Teachers Transforming Nursing Education. If you are not a member of that group, I highly recommend it. It is a group of over 17,000 nurse educators who share ideas, share documents. If you have a question or a problem that you're struggling with, if you will put that question in that group, you will probably get 100 answers within 24 hours. It is a great group. And if any of you are nurse educators, I would highly recommend that. As I mentioned in the beginning, my name is Maria Flores Harris, and I am the nurse educator for Keith RN. Keith brought me on board about 7 months now to help with implementation of the Keith RN resources. So if you're on the webinar tonight and you are a customer and you have any questions, you need support, you want best practices, please reach out to me, maria@keithrn.com. I will go ahead and put my email in the chat, or actually, you know what? I will put my email up on the screen. That will be easier. Please feel free to reach out to me. And for those of you that are not customers, if you have questions, feel free to reach out to me. I'm happy to answer your questions. I also want to mention our newsletter, and I'm going to put a link to the newsletter in the chat. I mentioned the newsletter because this month, our May newsletter is featuring other nurses like Kim, the nurse that we will have speaking tonight. Dr. Kimberly Delbo is on tonight. We have Dr. Monina Franco, who was featured on our Facebook Live last month. And we also featured another nurse, Tinley Force, who I hope will be on in June. So check that newsletter out. Sign up for our newsletter. Our newsletter always provides a lot of information, useful information. We give teaching tips. We provide resources. So it's not just a, hey, look at what Keith RN is doing newsletter. It's a newsletter to help you as an educator. So with all of that said, again, welcome. And tonight's topic, as I mentioned, is on professional identity formation. And I want to introduce our guest, Dr. Kimberly Delbo. Kim has more than 18 years of experience from bedside to boardroom while serving in professional healthcare and nursing practice, academia, and research. Dr. Delbo currently serves as a professor at Commonwealth University of Pennsylvania. I bet some of her colleagues are on the call tonight, I hope. She's also a co-founder of Radiant and Resilient Leadership and Nurses Lead with Heart, where she serves as a transformation and optimization coach, mentor, as well as a state, national, and international speaker. Dr. Delbo is a graduate of Liberty University in Lynchburg, Virginia, where she obtained her doctorate in nursing practice with a focus on healthcare transformation. Additionally, she is a master's prepared nurse expert with advanced specialization in community health nursing from Bloomsburg University of Pennsylvania, a 2010 graduate from Slippery Rock University, and a 2006 graduate of Thomas Jefferson University. Additionally, she's licensed as a registered nurse by the Pennsylvania State Board of Nursing and a board-certified gerontological nurse through ANCC. So having said all that, you guys know that she's good when you have to spend 5 minutes reading her bio, right? I'm going to bring her on. Hello. Welcome.
Oh, thank you so much, Maria, for that warm introduction.
It's so great to have you.
It's wonderful to be here.
I'm excited to have you. I've been following Kim on social media for probably about a year, and she's a busy bee, doing a lot of great things. And I was excited when I reached out and said, hey, would you join us? And she said, of course I will. And I thought, wow, how cool. So Kim, I always like to start by asking the question, tell us about how you became a nurse, why you became a nurse, and a little bit about your nursing journey.
Sure, I'd be happy to, Maria. First, I just want to say I'm just so delighted to be here with you all and celebrating the spirit and science of nursing with nurses across the country. And thank you for this wonderful opportunity, Maria. It's a joy to be here with you tonight. My nursing journey, nursing is something I wanted to do from a young age. I was called, I believe it's a calling for me personally. It's not simply a vocation. Nursing is my ministry. And when I was about 6 years old, I can remember back to when my mom bought me this Florence Nightingale dress-up costume and a little doctor's kit, because they didn't sell a nurse's kit at that time, right? It was just the doctor's kit, and it had the stethoscope, and I just love to play and set up clinic with my baby dolls and animals, and just engage with caring for people. But that's the reason why I became a nurse. It was because I felt called to be a nurse and to make a difference in the lives of people, and care for them, specifically those that are most vulnerable, including, patients, communities, disadvantaged communities, and also our students and even colleagues. So, as you mentioned, I've been a nurse in 18 years in various positions. My love and passion is really community health nursing and working with interprofessional collaborative teams across industries and sectors to address social determinants of health and address health equity while advocating for optimal cultures of health and well-being and safety at various levels. So the micro level, the meso level, and then the macro system level. So yeah, I'm really thrilled to be here with you all this evening. I'm engaging in this wonderful work that we have joined together with so many nurses across the nation to impact the lives of people and to ultimately restore health and well-being and vitality to those that need it. So in terms of my education, you went over that. In terms of my role in academia, I've had the privilege of serving in addition to being a bedside nurse in pediatric nursing settings, home health, gerontological nursing, hospice nursing, care management, various roles. My love and passion for nursing education was ignited, I would say, back in 2010 or 11, when I was pursuing my master's degree, actually at the university where I'm currently teaching. And at that time, there was a woman by the name of Michelle Ficca who was the chair, and she said, "Kim, would you consider teaching as an adjunct? I think that you would enjoy it." So I did, and I loved it. She was right. So I was so thrilled to enter into academia at that point, and I've been playing with that in that role since that point in my career. So I've worked with LPN students, diploma students. I actually was a director of an LPN school at one point during my last 15 years. And now I'm currently teaching at an undergraduate BSN program while serving also as that entrepreneur and independent contractor to work as a subject matter expert to design and facilitate healthcare leadership trainings for healthcare leaders across the healthcare continuum. So it's a little bit about me.
No, that's yeah. And one thing I will say that I've learned being a nurse for now, oh God, I can't believe it's almost 30 years. It's this year is 30 years. So, but for being a nurse that long and talking to so many other nurses, our paths are, I mean, we do so many different things. But to me, that's what's so cool about nursing is
Yeah,
you get bored in one area or you just want something different, you can just change paths and find something else that inspires you all over again. So
for sure.
no, I
So
appreciate you sharing that because it sounds like you and I have that in common as well, that I always knew I wanted to be a nurse. I never knew I wanted to be a nurse educator. That kind of fell in my lap. It was kind of asked to do it, and I thought, well, okay, I'll try it, and loved it. And it
yeah,
sounds like that was your path too.
it sure was.
Yeah.
Yeah, sounds like we have that in common.
Yeah, well, it's good to have you on that path.
Mhm.
What I would like to do before we really jump into the topic of professional identity formation is you have two businesses that you've co-founded, Radiant and Resilient Leadership, which I love the name of, and Nurses Lead with Heart. Tell us a little bit about those businesses and what you do with those
Sure.
businesses.
I'd be happy to. So, well, first of all, I just want to say my passion really is addressing burnout among healthcare workers. And that's kind of what led me to forming these two organizations, ironically, in looking at the literature and researching it in depth. So, but with that being said, as you said, I'm the co founder of both of these organizations. I served as a visionary and a transformation optimization consultant with Radiant Resilient Leadership, as a coach and a mentor, as at all different levels in terms of speaking and presenting. But it was initially started, R&R Leadership, or Radiant and Resilient Leadership, was initially started as a new startup in 2019, as a leadership consultancy and coaching business platform. Which, the desire, the tagline of the organization is to bring care back to caring. And that was the whole purpose. The mission of R&R was really to create excellent care and employee experiences by applying evidence-based practice research as I was transitioning and matriculating through my doctorate program at the time, and studying positive professional healthy workplace environments. I felt called to start this startup along with a friend and colleague, Angela Hummel, and I. And then the organization, it just kind of transpired over the time. And I'll have you pull up the picture of the model of caring leadership model. But R&R Leadership, it really provides that holistic, person-centered approach to working alongside of our healthcare partners across the continuum.
Yeah.
And it was founded and based upon the caring leadership model. And the caring leadership model is really based on the theory of human caring from Gene Watson, as well as the leadership challenge by Jim Cousy and Barry Poshner. And these two models combined, they really provide a base for heart-centered leadership. And that's really kind of where and why I serve and why I do what I do. It's because I really feel passionate that I want to lead from my heart and my mind, because I believe that's where true brilliance intersects. It lies where they intersect. And really together, this model is based upon the beautiful word agape. And for those that don't know what that word means, in Greek, the word means to love. And it can be translated as unselfish love, or the love for others, like a brotherly love for one another. So I wanted to just share with you briefly, if Maria, you can bring up the 5 tenets of the model itself. That would be the AGAPE acronym there.
Oh, sorry.
That's okay. Yeah. So just imagine, as we go over these 5 values, so to speak, that are found in the caring leadership model, how wonderful it would be if our workplace environments embrace this type of unselfish love and care for one another. And the A stands for always lead with kindness. G standing for generating hope and faith through co-creation. I love that word, co-creation. And who doesn't want hope, right? We all need hope and we all need faith. And then A again stands for actively innovating with insight, reflection, and wisdom. And then the P, is, as it's labeled there, is purposely creating a protected space. I think of psychological safety when I read this one. Purposely creating a protected space that's founded upon mutual respect and caring for one another. And then the E is embodying an environment of caring, helping, trusting for self and for others. So just imagine for a minute that this is what we had in each one of our organizations. And this is my vision for the future of healthcare, because I believe that every person is worthy of these tenets and these values that are embraced in the caring leadership model. So that's what R&R does. We come alongside organizations, healthcare workers, and associations to help promote and align with this caring leadership model while seeking to restore health and build leadership development into their organizations. Nurses Lead with Heart is very similar, but different in that it's a new startup. It was just recently launched this year in 2024 on Valentine's Day week, the week of Valentine's Day, as I was serving at Commonwealth University Briner School of Nursing. I had this vision to have Nurses Lead with Heart and this acronym, and I pitched it to one of my colleagues, and she was an early adopter, and she says, yes, I love it, let's do it. But it's based on the acronym. I like acronyms. What can I say, Maria? HEART, and it's based on humility, or cultural humility, empathy, authenticity, resilience, and tenacity. And trying to embed these values and these skills, because they truly are skills, that can be taught and learned into tomorrow's healthcare leaders. So really, we envision that there's a dynamic landscape of healthcare that's undergoing tremendous changes and challenges on many levels. But we really need humanity at the core. And that's what Nurses Lead with Heart is designed to do in terms of a curriculum. So it really promotes addressing the transformative barriers and using power in the process of leveraging social capital and even the social impact theory, which is rooted and grounded in the ethos of love and compassion and goodwill. So, very broad overview of these two organizations, but we're excited to see where they go moving forward. But ultimately, we're seeking to restore and help our student nurses grow as social change agents and healthcare innovators for the future
So
in seeking to change healthcare.
that's what I was going to say. Is it sounded to me like the R&R leadership was really more about practice or companies, and Nurses Lead with Heart is something that was more geared towards curriculum teaching students. And with that in mind, I want to delve a little bit deeper into that, because I know that leadership skills obviously is near and dear to your heart when it comes to students. And I think we get so focused in nursing education on skills, the physical skills, the fundamental skills, the actual nursing skills, um, and I'm not sure that we do that great of a job when it comes to building leadership skills. So talk to my question really is, why are leadership skills so important to develop in nursing school with our students?
Wow, that's a loaded question. Well, leadership development is a critical to new nurses, right? Our healthcare system and educational systems, and this is where the disruptor is going to come out a little bit, right? Our healthcare system and educational systems are broken, right? We spend more, and that's not me being negative, because I don't see myself as an as a pessimist in any way, shape, or form. I really truly am an optimist, but I do believe that it's important to identify an issue so that we can solve it and fix it ultimately. But the data shows us that, we're spending more money on healthcare than any other developed country in the United States, and our outcomes are the poorest. We're faced with a pivotal time. There are so many significant challenges. And I think I sent you a picture of some of these challenges. And I'm sure the nurses on the call today or on this live stream are really seeing these challenges in their own organization. You may have heard of the, population demographic shift that's going to hit us hard. And that's going to have major implications for our healthcare system, or the burnout epidemic or social isolation epidemic that we're experiencing, or potentially the shift from a volume to a value-based care model, or shrinking reimbursements, or increased chaotic work environments with increased acuity of care. There are so many challenges, but ultimately, again, it sounds a little negative, but it's not. With every challenge, I believe, lies an opportunity. And this is the positive part of all of it, right? This requires nurses and healthcare leaders to rise up and to help encourage, grow other leaders, and ultimately even improve the health of their communities as a whole as we shift to this volume to a value-based care model. So I'm really passionate about stressing some of these issues, and one of them, as an educator, that I wrestle with every day and have ever since I heard the news of the new nurses that are graduating and from nursing school, and nearly 1 in 5 of them are choosing to leave the profession of nursing within a year of becoming a new nurse. This resonates with me, and it's not good with my heart. So I feel that as nurse educators, we have an essential role to empower our nurses to function as leaders to the oneself, right? First to themselves, and then impact the ability to lead others, whether it be their patients, their families, their colleagues, their organizations, and even, again, the community in which they live. This is critical. Leadership development is critical to realizing a culture of health and ultimately well-being, as well as sustainable development sustainable development goals as articulated by the United Nations across the globe. Health is wealth. And we must lead the way as nurses. And the data is clearly showing that we're not always so good with we're good at sometimes taking care of others, but we struggle with taking care of ourselves. So that's also really near and dear to my heart, is trying to help empower nurses to see the need in wanting to lead oneself to be able to impact the health and well-being of others. But leadership development and the pillar of professional identity formation as one of the pillars, because we're going to talk about a couple of others, I think, right? This is truly an anchor. It's an anchor for a rapidly changing discipline. It's a moving target, nursing and healthcare, and it's going to continue to be for some time, but it ultimately contributes to nurse flourishing, and it drives employee and patient satisfaction, as well as their experience and patient outcomes. It's all tied together,
Right. Absolutely. Absolutely. There's so much to unpack there. But before I do that, I want to speak to the audience. Audience, questions, comments, please feel free to put them in the chat. We want this to be a dialogue. We really just have a few points to make. We want to make the points, but we want to make this a dialogue so we can talk about what you want to talk about. So please, what I would like is the challenges that you mentioned, Kim. There were so many things there that resonated with me as well. The new nurses leaving and the burnout. I know that I actually have something on my desktop right now. I should remember her name. I should have it ingrained. But the young nurse who wrote a letter to her abuser nursing and committed suicide. That I can't believe we haven't talked more about that. I do want to, and actually I'm hoping that next month we talk a little bit more about that when we talk about transition to practice, because we never want that to happen. I never want to read another letter like that. I don't want to see that again. So to the audience, what challenges are you seeing? Because we are going to talk about professional identity formation. Leadership is just one of those pillars. We're going to talk about ethics and values. We're going to talk about professional comportment. And what I think Kim and I both want to be sure to point out is that professional identity is not just something that we teach in school. It's not just something that we talk about. It's not just something that you glaze over. It really is critical to nurse well-being and to patient outcomes. The literature's out there that says that nurses with strong identity are happier and more fulfilled. There is research out there that says that when a hospital has nurses with strong identities, patient outcomes are better. So we're going to unpack that a little bit. Please feel free if you have any challenges, anything you would like to say about your leadership teaching in school, please feel free to put that in the chat. I'm going to go ahead, Kim, and I am going to share the 4 pillars. I'm just going to throw those up on the screen so that everyone can see how these pillars are defined by the International Society on Professional Identity. Values and ethics we're going to talk about. And I love these definitions. And I heard Nelda Godfrey talk about these definitions and how much time and effort they put into the definitions. So they didn't just go to Webster and pull out words. They actually came up with these definitions and really put some thought into it. So values and ethics, a set of core values and principles that guide conduct. Nurse as a leader. I love this definition. Inspiring self and others to transform a shared vision into reality. And professional comportment, a nurse's professional behavior demonstrated through words, actions, and presence. I love those definitions. I think, Kim, you really unpacked leadership for us there. And I think you really, without saying those words, you hit on that definition, that it was about inspiring self and others to really create a shared vision and
Mhm.
to actually make that vision a reality. Is there anything else you want to say on leadership before we move on from that?
I think that, I mean, that covers it all in a nutshell, Maria. And, I think of John Quincy Adams' quote on what, how do we define leadership, right? And, leadership, a leader encourages others to dream more, do more, become more. And if they do that, they're a leader. Leadership is influence, nothing more, nothing less. So, that having that shared vision is essential. Leaders need to know where we're going, and they have to have a plan to get us there, while pursuing excellence, of course, and demonstrating trustworthiness and communication and all that goes with it. So
Correct.
this is wonderful. Thank you so much. And
Well,
I'll
I
open
will
the
say
question.
this about leadership too. I always pointed out to my students that you students especially, but you know what? It's not just students; it's all of us.
Absolutely.
When we think leader, we have a tendency to think about someone with a title.
That's right. And it has nothing to do
And
with
it
time.
has nothing to do with the
Yes.
title, right? I think all of us can say that there have been informal leaders in our life who did not have the title, who have been more of a leader than anyone that did have the title. And
Mhm.
that's so important to know that leaders are everywhere. Absolutely.
Yeah, critical. Thank you. Thank you for sharing that. It's so
Uh,
true. And that's kind of what I share when I talk with Radiant Resilient Leadership. It's the same thing. Leadership isn't defined by a title. And even the thought of leadership, right, Maria? We think leader, when we think of leader up till, like, most recently, it was always that top down, right? That linear leadership model. But
mhm.
gone are the days where that's going to be
Right,
the course that we move forward as we navigate the future of healthcare transformation. It's going to require collaborative leaders, right?
right.
And we could talk all day about
Right.
leadership. Let's move
We could
on.
servant leadership. We haven't even used that
Yeah,
terminology, but wow. I mean,
yeah.
well, I want to get Anita has a great question in the chat that I want
Mhm.
to, I'll bring it up here. Any suggestions or strategies for nurse educators like me to begin to build resilience
Mhm.
early while they are still students, long before they graduate and enter the profession of nursing?
Mhm.
Is there anything that you could share there, Kim?
Yes, absolutely. So Anita, I would be happy to reach out to me privately. I can share more for time purposes today. Obviously, this is a really important thing that we need to start doing while they're matriculating through nursing school. And I would even think before they even get to school at a primary and secondary grade level. With nursing students, particularly, we need to make sure that we are preparing them, telling them the truth of what they're going to be getting into, so that they can have the skills, and then helping them to understand what resilience is. I think of smart leadership, right? Stress management and resilience training is something that can be implemented while they're matriculating through schools, helping them to understand too how they are connecting their body, mind, and spirit is essential, right? Because we're all holistic beings. We treat our patients holistically. We need to make sure that we're treating ourselves also holistically and preparing our students to do just that before they're ready to enter the workforce, so that they don't feel that they want to leave within a year of training. The other thing, research has clearly shown the importance of practicing gratitude and appreciation. So I would instill that every day, every chance you have in your classrooms. I'm a firm believer in that, as well as some other nurse leaders out there that I've read their research and have sought to implement that in my own work.
Thank you, Kim, for answering that. Kim mentioned that you could reach out to her. I have her email up on the screen here. I will put it back up again, but at the end of the, the webinar here. I'm just checking. Okay, just checking to see if there were any other comments before we move on. And hello, Amanda. I see you have joined. Nice to see you. Um, so, Kim, I want to move on. We've talked about leadership. I want to talk about values and ethics and professional comportment. The other, I should say, two other pillars. There are four. We're not talking about knowledge because knowledge is pretty self-explanatory, and knowledge is what most of us are focused on in the classroom.
Mhm.
So let's look at professional comportment.
Sure.
How do you see the pillar of professional comportment? How do you teach it to your students? What are some maybe practical strategies for professional comportment? And when I say teach, obviously I'm using that very loosely. I know that role modeling is a big part of that. So just give us some strategies on professional comportment.
Sure. Well, I mean, professional comportment is the nurse's professional behavior, right? That how they demonstrate and act with their words, their actions, and even their very presence, how they enter the rooms, how they carry themselves. It refers to their behaviors, whether they're respectful or are they compassionate, are they deliberate in their interactions with one another, and it's not just with themselves, right? Other disciplines in healthcare, we don't work in silos. So our professional comportment, even the formation of that, isn't necessarily have to take place in silos. So our healthcare system in general, it requires that we all have a high level of trust between disciplines in order to develop this professional comportment appropriately and ultimately seize opportunities in the process. But so professional comportment, it really is the nurse's professional behavior, right? As I said, it in terms of how we teach it, I believe first of all, as nurse educators, we have to embody it. Right. It starts with us. We
Absolutely.
embody professional comportment by treating all people, regardless of what their title is, with dignity and respect. And this will come out. This will come out in your daily interactions with each and every person you interact with, your very persona, how you talk, how you interact with them every day. And as educators and nurses, because we're both, I believe also it comes out in how we advocate for others and how we communicate with others, whether it be our students, our colleagues, or our community. And
Absolutely.
we also, I think, is prioritization, right? If we prioritize the incorporation of this into our coursework, into our simulations, into our competency-based curricular threads and standards, this is necessary for us to do this. When we look at professional comportment education, it truly is essential for every nurse to have. So, this is, recently we had the privilege of doing this at our university, at Commonwealth, Reiner School of Nursing. We were seeking to decrease incivility and looking at how we're going to prepare our future nurse leaders to lead effectively in a civil manner and ultimately among all healthcare workers. And what we did was my faculty team and I, I serve as the Branner School of Nursing chair of the Healthy Workforce and Learning Committee. And together our team was able to roll out civility promotion training across the entire curriculum for the undergraduate students just this spring. So we utilized the 4 videos put forth by Dr. Cynthia Clark within the Keith RN platform. So we want to thank you for that. And also, we provided presentations to them, engaged in a brief dialogue, role plays, engaged and had the students engage in self-analysis and even reflect upon their clinical encounters, and then look at how they can embody this culture of civility and professional identity formation and comportment in their respective roles. So it was a really empowering time for the students this semester to do that. I think another way as educators, what we can do is it's critical for us to help the students feel equipped to engage in coaching conversations and mentorship,
Right.
even with one another from one level to the next.
Right.
So we've started to do that and incorporating more mentorship into our, I've actually created a tool based on the caring leadership model with coaching conversations that I sometimes review with my students. But other things that, obviously we need to think about is how are we going to embody this in technology. How are we going to use technology in a way that's going to help nurses to use their professional identity and their comportment to effectively leverage their voice, and ultimately promote the science and spirit of nursing while elevating the health of their communities and vulnerable populations. And we have a couple ideas, thinking about moving forward in implementing here at the Briner School of Nursing, but technology is a wonderful resource that we can leverage to effectively do this. Also, I would say with this specific pillar, when we look at this, we need to think about how we're integrating nursing professionalism, and making sure students understand that this is a continuous process of socialization. It's not that they're going to graduate and everything's going to be all good, right? This is a continual process.
Right.
So I think that that's really critical for us to share with
Right.
them. Make
Those
them.
are great strategies, Kim. I had tons of strategies there. I love them. And Lori, I was not ignoring your question. Lori had asked about suggestions to foster basically advocacy in students. And I think you covered that. And I think we're going to talk about values and ethics, and we'll probably cover it even a little bit more. So Lori, if your question is not fully answered, just feel free to jump back in and ask it again. Um, I do want to talk about values and ethics. That really is one of my favorite things to talk about.
Mhm.
Because it's so important. We can't assume, that's number one for me. We can't assume that our students know what the values and ethics of nursing are. And I always share with my students integrity. We
Mhm.
have an issue with academic integrity, and
Yes.
academic integrity leads to professional integrity issues. Academic integrity issues, I should say, will lead to professional integrity issues.
Mhm.
Having said that, I always share with my students that for how many years in a row now? I think it's been like
Mhm.
almost 20 years, right?
Right.
Nurses have been considered to be the most ethical profession in this country. That says a lot. And I tell students that is the profession that you are entering.
Mhm.
So talk a little bit more. Same question, really. What values and ethics do we need to be talking about with our students when it comes to nursing, and maybe what are some practical strategies that we can use to teach those?
Awesome. Yeah. So, well, values and ethics are critical. They're foundational, right? So I appreciate you sharing that about integrity, because without our integrity, what do we have? And I always tell my students that, right? Like it
Right.
really is, it's who you are. And if we're willing to risk our integrity for a grade on an exam, we're so much more than a grade on an exam, right? How do we define our self-worth, right? What are our values? But values and ethics are really that core set of principles, as the definition you put up on the screen earlier showed, right? It's that those core principles that guide our conduct as a healthcare worker. So nurses, I think it's critical for us to, and as educators, to analyze our own values and our norms and model them, right, for our students. That's number one.
Right.
Professionalism as it relates to values and ethics, really, we really need to encompass the development of nursing identity by embracing things like you said, integrity, inclusivity, diversity, belongingness, compassion, humility, advocacy. You mentioned that, and we're going to get more to that in a minute, but caring, the very essence of nursing practice, caring for one another, us and ourselves as well, and even practicing autonomy, while promoting and uplifting humanity and social justice. I think all of these are so critical for us to integrate into our nursing programs, as and reflect that in the work that we create alongside our students, and even the assignments that we create, and we have the privilege of creating for our students. But as educators, I think it really starts with us teaching it in a number of ways. Again, there's no one way to do something, and that's the beautiful part of nursing and nursing education. But really, putting this into your curriculums, your course competencies, as well as your sub competencies, and then making sure that you are having the students demonstrate ethical comportment in their practice by reflecting on even the mission that they have to being part of a greater society. We have a responsibility as nurses to take care of oneself, the scope and standards of practice and ethics, to take care of oneself as well as to care for others. So we have this mission that's out to care for our society. So we need to encourage our students to, report unethical behaviors when they see them and listen, actively listen to them and prepare them on how they're going to respond to that using effective conflict resolution and assertiveness skills. It all ties together, really.
Mhm.
With the leadership earlier that we mentioned, safeguarding privacy, confidentiality, right? And this isn't just with our day-to-day actions, but also even considering technology. You need to make sure that we're properly utilizing technology. This is a technology revolution. We're in the midst of so much change in healthcare: artificial intelligence, machine learning, telehealth, virtual nursing. All of this is changing all at one time. And this is the time that we need to make sure that we're instilling these values that are so critical to making sure that we can elevate the profession as a whole. And then
Absolutely.
I'd say, as educators, we have to make sure that we're encouraging our students to analyze the current policies and practices to function effectively in and under an ethical framework. When we're thinking about advocating for practices and to advance things like diversity, equity, and inclusion in their roles as nurses, and even in the school communities in which they attend the schools. They can take a leadership role in helping to promote this at that academic institution. But it really kind of starts with role modeling those expectations as educators. It starts with us
Right.
setting expectations high and
Right.
not lowering the bar. Right? I'm a firm believer. If we raise the bar high enough, people will also increase their work.
Absolutely.
Water it down, everyone will take the lower road. So we really kind of
Absolutely.
have to make sure we're raising that bar high and incorporating, you know, um, participatory action alongside nurse mentors and leaders. And that's kind of what we're doing here at Commonwealth and our vision for the future. So I'm really excited to see where it moves. But, dilemmas are bound to be happening in healthcare as we move forward. And we need to make sure that we're preparing our students to be that voice, to be that advocate, and to ultimately, help patients feel empowered to honor their right for self-determination, their right for
Mhm.
strong, good health care,
Mhm.
um,
Mhm.
because it's for the patients, right? And that's the reason why we're serving, and the public, as well as our colleagues and our
Absolutely.
professional collaborative team members. So, and even advocating for their needs in the
Yeah,
process.
absolutely. I appreciate that answer. I will add that, Lori, this goes back to your advocacy, and Kim, what you were just saying. We need to role model what advocacy looks like. There are
Mhm.
times I was just recently at a conference with Keith, and someone shared a story in one of the sessions that I went to, where she had students who were being treated very poorly on the unit. I mean, very poorly. She gave the stories, and I was appalled.
Yeah.
And she had to advocate for her students to the leadership of the
Oh,
hospital,
oh,
and
for
that is
sure.
something. But I mean, that is role modeling the behavior that has to happen, even though it was uncomfortable, and she
Mm,
was afraid of what the consequences may be. She did it because it was the right thing to do. So it's
mm,
so important
mm.
that we're
Yeah.
showing students what it looks like, because I have a student, who wrote, well, I didn't, but I saw where the student says that education does such a good job of teaching us how to be strong and how to be perfect, but they don't do a good job of teaching us how to be weak when we do something wrong. And I think that to me really hit me, that it's so important that we are talking about the bad things in nursing and the bad things that can happen, and giving them an opportunity to maybe
Mhm,
role play that, and talk through the communication with that. So thank you
mhm,
for
mm,
that. We are about 10 minutes to the end of the hour, and there is something that Amanda posted in the chat that I kind of wanted to get back to, because I think it's, Kim, that it's a good way to wrap all this up. To wrap up really what professional identity means, what it
mhm,
means to not just the student and the nurse, but what it means to everyone around that student and that
mhm,
nurse, the institutions, the communities,
mm,
the patient outcomes that we were talking about. And Amanda's question was, is there information on why students are leaving? And that's why I think if we start talking about a little bit
mhm,
about why students are leaving, it kind of leads us to, this is why we really
mm,
need a strong identity as a nurse. So I'm gonna, if you have, some information that you want to share on that, and then we'll kind of wrap up. I think, like I said, I just think this is a great way to wrap up
mhm,
why all of
mhm.
this is so important.
Mm, absolutely. Well, Amanda, nurses are what, 5 million strong in the United States. And not just the new nurses that are leaving, right? There are veteran nurses that are choosing to retire early. And part of it is that we are recognizing that we need a healthcare system transformation. And it's not a healthy environment in which we're working. And nurses are finally realizing that we're not going to um, work in environments that aren't healthy, right? Because it's our life that is at stake, and we're not willing to sacrifice that to care for others. But we will care for others in a way that's going to honor them, and we want to provide quality care. But in some cases, we can't because of the systems in which we're working. And it's not that it's all systems, right? It's a combination of both individual preparation and factors. And I don't want to feel like I'm pointing fingers at the healthcare organizations or systems wholly, because it's not just the organizations per se, but as a system overall. And when we're looking at this, when we're thinking about the quadruple aim, and that's what you were getting at, Maria, when you mentioned about the quality outcomes and improving population health, and ultimately restoring joy to practice while redesigning the healthcare and educational ecosystems in the process. And really, when we look at this, professional identity is a framework, right? It's a framework, we said it earlier, to frame how people think, act, and feel like a nurse. And we need to be astute and take this seriously when it comes to helping our students and in inviting them, as well as nurses that are in practice, to define the norms and the values, and ultimately help to improve patient outcomes for our communities as a whole. Again, professional identity formation, this isn't a linear process. This is going to go on over time, over the lifespan of a nurse, and it's meant to be a lot longer than just 1 year. So personally, for me, when it comes to the community, it goes back to providing positive, professional, healthy workplace environments and communities where people can flourish and thrive. And not just nurses, but all of us, right? That this is going to ultimately be tied to promoting economic stability. As I mentioned earlier, health is wealth. And when nurses show up and they provide care for patients, for their colleagues, for their community or their organizations, it impacts patient safety and quality care outcomes, and improves organizational resilience as well, and even
Absolutely.
sustainability. So we don't have a choice. We need to change. And this is the perfect time for nurses to rise up as the leaders that we are, because we do influence care every single day.
Absolutely, we do. Amanda has a great follow-up question, and as I put this up and read it, if any of you have any questions, please feel free to go ahead and put them in the chat. We'll wrap up with questions. Amanda, I think this is a very astute question. Do you think that there is a correlation between the increasing ethical and empathic challenges of new nurses and the desensitization of younger generation?
Hmm. That is a loaded question, Amanda. I would think that there is, but I don't have literature to support it. So, but that definitely sparks an interest for me, and I'm going to do some more research on that. But when you think about what we're dealing with increased ethical issues, and then we're looking at empathetic challenges. I mean, we're seeing this on many levels, right? As nurses, um, and then the new nurses come on board into this situation. It's a lot. That's a lot for somebody that has years and years of experience. My
Mhm.
son became a nurse in 2020. The year of the nurse, Gabriel. He is a heart and vascular ICU nurse, and he's my why. He's the reason why I feel very passionate about addressing healthcare worker burnout. To them, him and my nursing students, and they'll. Sorry, no, it's great. I don't know what she apologized for, but I don't. No need to apologize, Amanda. It's an outstanding question. But no, to get to the root of it, it definitely has been very challenging for Gabriel as a new nurse, stepping into the realm during COVID, graduating. I mean, well, he was sent home in March of his senior year, never finished his academic, he never walked for graduation, never had that celebration, so to speak. And then he entered the workforce during the pandemic. He actually left his job at Duke University in the heart vascular ICU to come help serve in senior living. At the time, I was a director of nursing services and innovation. My husband was an administrator. Needless to say, he experienced burnout early on in his career, but he's recuperated and fully recovered today. But it was quite the challenge for him. And I feel for new nurses that are experiencing situations like Gabriel or even myself in having to work with systems that aren't always as supportive as we could be, and even as nurses. So I'm all about trying to make it a better place for the ones that I can influence, and I'm sure you all are as well. But that's just my thoughts. But I do believe that there is a correlation there. I just don't have the literature to support it.
Yep, yep, yeah. I'm with you. I believe it too, but I don't have anything to support it. Um, as we wrap up, I have one final question for you, Kim, and please, any of you, feel free to add any comments or questions in the chat. My question is, what is your call to action for all us nurse educators when it comes to professional identity?
Yeah, I love that. Thank you for that opportunity. If I had to give a call to action, my call to action is simple. It's for every nurse across the globe, regardless of their role, lead with your heart. Prioritize the cultivation of professional identity formation within your respective organizations, whether it's in academe or practice. In the process, clearly delineate what the norms are, what the values are of the nursing discipline, and what you seek to promote within your organizations among your nursing students and your colleagues, as well as your affiliation partners, because we're all in this together. We need to make sure, and I would encourage everyone to model professional comportment and conduct ourselves with integrity. In so doing, we need to prioritize leadership development, including emotional intelligence, and encouraging our nursing students and everyone within our organizations, regardless of what their title is, to lead with heart, humility, empathy, authenticity, resilience, and tenacity. Ultimately, I would say, lastly, my last call, well, it's all one big call, is respect and challenge the status quo. Embrace your voice, embrace your vitality. And as you practice and champion with advocacy, especially for those most vulnerable, promote health equity. And remember that true brilliance will always lie where your head and your heart intersect. So allow the truth of what you know in your head and in your mind, to move to your heart. That's my call.
I love it. That's a great way to end. Thank you
Thank
so much for those great words and for all the great discussion and great strategies. I want to say to the audience again, thank you so much for joining. We appreciate you giving of your time. Don't forget to go to the Think Like a Nurse YouTube channel to sign up, and you can see this recording, our Facebook page. I also am dropping in a link. We do have a monthly clinical judgment workshop, how to develop clinical judgment. It is a free workshop, and the next one is coming up June 7th at 11 a.m. Eastern Time. So that is a link to sign up for that. And then I will mention one last thing. We also have a brand new course on how to develop clinical judgment, and it is an awesome course. And I'm dropping in a link right there in the chat for you guys to check out the hub, the Keith RN Hub. You're able to get the first part of the course that goes over the issue of lack of clinical judgment and all the research about clinical judgment. You get that for free. And if you are a member, you get the entire course for free. And there are 5.4 CEs with that as well. So just wanted to mention that to you. Thank you all again for joining. Kim, thank you so much. This was an important conversation. It was a great conversation. I love all the, like I said, the strategies that you gave. Thank you for joining us. We
Thank
appreciate
you,
it.
Maria. Thank you so much. My pleasure to be here with you. Oh, happy Nurses Week, everyone.
Yes, happy Nurses Week.